Welcome to a brief video on assertiveness training from ABCT's archive of fact sheets. My name is Akanksha Das and I'm a third-year clinical psychology graduate student. ABCT fact sheets are created by a team of interdisciplinary experts. Please see the link provided in the video description for more information about the team behind this fact sheet. So what is assertiveness? Have you ever been to a party and found yourself avoiding someone because you didn't know what to say? Have you ever realized after the fact that you've been unfairly criticized or taken advantage of? Are you hesitant to express your thoughts and opinions? Do you find dealing with authority figures difficult? These are all examples of situations that involve assertive behavior. Assertiveness can be defined as communication in which one expresses oneself in a direct and honest manner while simultaneously respecting the rights and dignity of others. One of the core principles of assertiveness training is that we all have the right to express our thoughts, feelings, and needs to others, and to do so consistent with our mutual value of respect. In fact, what we find is that when we don't feel like we can express ourselves openly, we may become depressed, anxious, or angry, and our sense of self-worth may suffer. Our relationships with other people are also likely to suffer because we may become resentful when they don't read our minds for what we're not being assertive enough to tell them. People sometimes also confuse assertiveness with aggression, believing that assertiveness training might make them pushy or inconsiderate of others. In fact, assertiveness can be thought of as a middle point between passivity and aggression. In interpersonal situations, passive behavior occurs when you focus on the needs and desires of another person, but ignore your own needs and wishes. In contrast, aggressive behavior occurs when you force your own needs on others. Assertiveness training is helpful for those who either tend to be overly passive or overly aggressive in interpersonal situations. Importantly, there are no hard and fast rules of what assertive behavior is. Rather, it's specific to the particular time and situation. So, behavior that's appropriately assertive for one person in one situation may be either excessively passive or too aggressive for someone else in a different situation. Importantly, assertiveness training is based on the idea that assertiveness is not innate, but a learned behavior. Behaving assertively can sometimes be difficult for almost anyone and is often impossible for some. For this reason, assertiveness training focuses not only on talking about the importance of assertiveness, but also on learning assertive behaviors and practicing these behaviors with the help of a professional therapist. Therapists can help clients figure out which interpersonal situations are problems for them and which behaviors need the most attention, taking both the time, situation, and cultural context into consideration. In addition, therapists help to identify beliefs and attitudes that clients may have developed leading to these patterns in interpersonal relationships. Once clients understand the importance of assertive behavior for their situation, therapists help them develop more assertive verbal and nonverbal behaviors. For more information on the specific types of techniques or skills that may be used in assertiveness training, I invite you to read the full ABCT fact sheet on assertiveness training, linked to this page. Take a closer look under the How is Assertiveness Training Done and Examples of Assertive Techniques headings. All of us can learn to improve our assertiveness skills. Some people are able to improve their skills by reading books on assertiveness training and practicing the exercises outlined in the books. For many others, however, professional help is necessary to make real and lasting improvements in assertiveness skills. This is especially true if one's interpersonal problems are associated with strong feelings of anxiety or depression. If you or someone you know might benefit from assertiveness training, it's important to find a therapist or counselor who's an expert with this approach. Ask directly about the professional's training and experience with assertiveness training. Your family doctor may be able to refer you to a competent professional. Another option is to contact the referral office of the Association for Behavioral and Cognitive Therapies at the number listed on this page, or take a look at the ABCT website to search for a therapist in your area. Good luck!